Imagine a patient entering the emergency room. She is awake. She is confused. But when the nurse draws her blood, the syringe fills with a fluid that smells like ammonia. White crystals are floating in her veins. Within minutes, the nurse faints. The doctor passes out. The hospital declares a state of emergency. This is not a movie about a virus. This is the true story of Gloria Ramirez, the woman whose body mysteriously became a biological weapon that took down an entire medical team. It was the evening of February 19th, 1994. Riverside General Hospital in California. The emergency room was busy, but routine. At 8:15 p.m., paramedics rushed in with Gloria Ramirez. She was 31 years old, a mother of two, suffering from advanced cervical cancer. She was struggling to breathe. Her heart was racing, and her blood pressure was crashing. The medical team, led by Dr. Maureen Welch, went into overdrive. They injected her with Valium, first in Ativan to calm her down. Nothing worked. Her heart rate was still too high. As a last resort, they decided to defibrillate her, shock her heart back into a normal rhythm. But before they could shock her, they noticed something strange. Her skin. It had an oily sheen to it. Not sweat, but like a layer of oil. And when they tried to ventilate her, Dr. Welch smelled something fruity and garlicky coming from her mouth. Then, Nurse Susan Kane drew blood from Gloria's arm. And that's when the nightmare began. As soon as the syringe filled, Kane noticed a chemical smell. Ammonia. Strong, pungent ammonia coming from human blood. She handed the syringe to a medical resident, Julie Gachinsky. Gachinsky looked at the blood. It wasn't just the smell. There were manila-colored particles floating in the blood. Crystals in a human being's veins. Seconds later, Nurse Susan Kane turned pale. She leaned against the wall and slid to the floor. She had fainted. Dr. Gachinsky felt nauseous. She left the trauma room and sat at a nurse's desk. A colleague asked if she was okay. Before she could answer, she collapsed. And she didn't just faint. Her body started shaking with apnea. She stopped breathing for several seconds at a time. Chaos broke loose. This wasn't normal stress. Seasoned trauma doctors don't just faint in groups. Inside Trauma Room 1, people were dropping like flies. A respiratory therapist, Maureen Welch herself, eventually passed out. In total, 23 out of 37 emergency room staff members became ill that night. 5 were hospitalized. Dr. Gachinsky, the resident who looked at the crystals, spent 2 weeks in intensive care. She developed hepatitis, breathing problems, and a vascular necrosis in her knees basically. Her bone tissue started to die. She was a healthy young doctor before that shift. The hospital directors had no choice. They declared an internal disaster. For the first time in the county's history, a hospital emergency room was evacuated not because of a fire or a bomb, but because of a patient. They moved all other patients to the parking lot. The staff stripped off their scrubs, terrified that they had been exposed to some deadly nerve gas or a new super. Meanwhile, inside the empty emergency room, a skeleton crew of 2 doctors donned hazmat suits. Those yellow protective suits you see in movies to stay with Gloria Ramirez. They tried to save her, but after 45 minutes of CPR and defibrillation, she was pronounced dead. But the mystery didn't die with her. 2 staff members were tasked with moving her body into a sealed aluminum casket. They were terrified. What had killed her? And more importantly, could it kill them too? The autopsy of Gloria Ramirez was conducted under extreme security. The pathologists wore full protective gear, looking like astronauts. They expected to find a hidden poison, a radioactive source, something. They found nothing. Her organs were consistent with someone who died of kidney failure caused by cancer. There was no ammonia in her blood anymore. No crystals. No secret poison capsule in her stomach. The official report released months later was underwhelming. The health department stated that the staff suffered from mass hysteria. They claimed the smell was maybe just a side effect of the chemotherapy, and the stress of the situation made everyone panic and faint. The medical staff was furious. Dr. Gachinsky, who had her knees destroyed, sued the hospital. Mass hysteria does not cause bone necrosis, she argued. You don't imagine your bones dying. You don't imagine crystals in a syringe. If it wasn't hysteria, what was it? This is where the chemistry gets dark. A team of researchers from Livermore National Laboratory proposed a theory that is scientifically terrifying. Gloria was likely using a home remedy called DMSO, Dimethyl Sulfate, to manage her pain. It's a powerful solvent used by athletes, which would explain the oily sheen on her skin and the garlicky breath. But DMSO isn't deadly. However, the scientists theorized that because Gloria was in kidney failure, she couldn't pee the chemical out, so it built up in her blood. When the doctors gave her pure oxygen, the DMSO oxidized into DMSO to dimethyl sulfate. This substance crystallizes at room temperature. That explains the crystals in the syringe. But here is the kicker. When they shocked her heart with the defibrillator, the electric jolt might have converted the DMSO into DMSO for dimethyl sulfate. Dimethyl sulfate is not a painkiller. It is a powerful nerve gas. It destroys cells, causes convulsions, and can be fatal. The theory is that the doctors accidentally turned Gloria's own body into a chemical weapons factory just by trying to save her. The family of Gloria Ramirez never accepted the mass hysteria theory, nor fully bought the chemical theory. They believed something simpler and darker happened. A hospital error. They pointed out that the hospital had a history of safety violations. They theorized that maybe a vent leaked sewer gas, or someone mixed the wrong four-bag, but the toxic lady label stuck. Gloria was buried in an unmarked grave, 10 weeks after she died, because no funeral home wanted to handle her body. Her internal organs were removed and kept for testing, but they were never returned. Think about the tragedy of this. A woman dies in agony, scared, surrounded by doctors who are passing out around her. And instead of being remembered as a victim of cancer, she is remembered as a biohazard, a human toxic waste dump. To this day, science has not proven 100% what happened that night in room 1. Was it a free chemical reaction caused by a defibrillator? Was it mass panic? Or is there something else hospitals aren't telling us? Every time a nurse draws blood today in Riverside, there is a shadow of that night. The fear that sometimes the danger isn't the disease. Sometimes the patient is the danger. Subscribe to the channel if you want to know what else medicine can't explain. We dig into the files they want to keep closed. Comment below. Do you believe the chemical reaction theory, or was the hospital covering up a mistake? I'll see you in the next emergency.